Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm your host, Lex Frieden. Today, through the resources of the Municipal Channel of Houston and ILRU, the Independent Living Research Utilization Program at TIRR, we have the good fortune to do an on-location shoot in Washington, D.C. And we're here today at the National Institute on Disability and Rehabilitation Research with the Director of Research for that agency, Dick Melia. Dick, thanks a lot for being our guest. And you heard me make reference, slipped, and talked about one of your predecessors,
That's
Dick
right,
LeClaire.
Dick LeClaire, and remember him very well as one of our program managers back when the Institute was just formed.
Now that actually brings you and I to a subject that's interesting to both of us, and we both have a history about it, and that is the history of rehabilitation research in the United States. I recall as being a graduate student in the early 1970s, having been disabled in the late 1960s, finding out about the rehabilitation research program in the United States, and at that time it was a part of the Rehabilitation Services Administration, and I guess had started a few years before with Mary Switzer's initiative. Dick, you were already working in rehabilitation research at that time, I think, in the RSA program, and you have a great wealth of knowledge about this program.
Thank you. Yes, Mary Switzer deserves a lot of credit for establishing the Rehabilitation Research Program, and this building that we're in is called the Mary Switzer Building, the first federal building named after a woman. So we're very fortunate to have had Mary's influence on rehab research. Through her influence and senators such as Lister Hill of Alabama, the research provisions were added to the Rehabilitation Act in 1954. But it was predominantly a medical model for the first perhaps 15 years or so of rehabilitation research. And in the exciting times of the late 1960s and early 1970s, rehabilitation was turning to the social model of disability and to disability rights. There were a number of things happening, and it was at that point that I did my graduate work like you and first joined the federal government.
Now, your boss at that time was Jim Garrett, is that right?
Actually, I was brought in by Ed Newman, who was the Commissioner of Rehabilitation. And you're absolutely right, the Rehabilitation Research Program was under the Rehabilitation Services Administration in the early 1970s. So I had started, I did my graduate work, undergraduate work and graduate work in political science, and as I became more interested in disability, I became interested in the types of coursework that would help me understand better disability. So I took some coursework in public health during my graduate training as well. But I did a master's degree and a PhD study that related to planning of rehabilitation services in Massachusetts. And doing that work brought me in contact with groups that were of consumers, Massachusetts Association of Paraplegics. These were the language that they used at that time, disability related. But the Massachusetts Association of Paraplegics was really the forerunner of the group that formed the Boston Center for Independent Living. So we had a number of disability related organizations that were involved in the comprehensive planning projects in rehabilitation and related areas, and they were very active helping the government planners to identify needs, and I cut my teeth on processes that involved people with disabilities, their advocates, their representatives, service providers, dialoguing about issues.
Now that's very interesting, and I guess it's one of the aspects of the nation's rehabilitation research program that may be different from other research organizations and other research agendas, and that is that people with disabilities are intimately involved in the research programs and have been for many years.
Correct. We are fortunate that that our rehabilitation research across the board, programs in employment, programs in community integration, programs in medical rehabilitation, have brought together communities of interest and have raised the perspectives of many different parties to the important research. Consumers have learned the importance of medical research and how to define medical research, how to serve effectively as advisors in groups like institutional review boards and participatory action research, and specialists, physicians, occupational therapists, physical therapists, psychologists, others with academic letters after their names have learned how to communicate with end users, people who need to have ways of either improving their own functional capacity, having their functional capacity continue and not diminish, be able to function as well as they can given their level of disability. But we've found over the years that a very significant aspect of that is also the environment in which people function. Mm-hmm. A person can be maximized to the extent possible. You have a severe disability, you have many accommodations, you have many advantages of education and position, but if you wheel up to a curb cut that is not properly installed, you're stymied in your ability to move. And so you have to know how the environment is there to interact with the disability. And I am fortunate to have been in government and in research over this past nearly 30 years and have seen that evolution of thinking. And I'm glad that we've moved as far as we have, but I'm well aware that we have a long way to go.
Well, now, Dick, from the standpoint of relevance, I guess one of the things you mentioned, Mary Switzer, who founded the Modern Rehabilitation Program in the early 1950s. And one thing that I recall from history of rehabilitation is that Mary Switzer hired people with disabilities. She hired them to work in the federal government, and I know a couple of those people who were some of the first disabled employees in the federal government.
Absolutely. In fact, I have very fond memories of one of my mentors in the early days, Boyce Williams, who unfortunately died this past December. Boyce was one of the first deaf individuals to be hired as a member of the federal rehabilitation staff. And he formed the Office of Vocational Rehabilitation for the Deaf, or the branch for vocational rehabilitation of people who are deaf within rehab. And when I was special assistant to Ed Newman, who hired me, brought me into Washington, never thought I'd stay in Washington, never thought, hey, you know, I'm just going to go for a short period of time and I'm out of here. I'm going to do something beyond the government. But somehow or other ended up staying. And when I worked with the Commissioner's Office, I was assigned to spend a good part of my time working with the Office of Deafness to help them with their planning and their initiatives. And it was a mind-awakening experience for me, because prior to that time, I didn't have any communication skills. I didn't know sign language. And working with Boyce helped me to learn some sign language, not a whole lot, but maybe enough to communicate with some people that use sign language. So what I experienced was some research and planning meetings that I was the ugly American. When I came into the meeting, I was the individual. Every time I opened my mouth, there was someone else that had to interpret for me. This happened at several meetings, small meetings. We'd have a meeting in an office, or even a planning conference we had at one time at Puerto Rico, tagged on to a national rehabilitation meeting. And all the folks around the room could sign. Poor Amelia, every time he opened his mouth, one of the hearing individuals in the room interpreted for him. Since then, we've come a long way with recognition of the need to provide qualified interpreters for our meetings and have interpreter support on our staff. But I think some of the sensitivity enriching activities that I was in to help me learn about communicating and working with people with disabilities. Mary Switzer knew that intuitively. She knew that if she brought people with disabilities into the government and into the planning and policy activities, that the very experiences like I had with Boyce and his co-workers would permeate. And that's been one of the exciting things about rehabilitation research, as it's been administered by RSA and then later by the establishment of the National Institute on Handicapped Research and NIDRR. We've tried to continue that model of involvement and participation.
And there continue to be many people with disabilities who are working in the agency with rehabilitation research and rehabilitation, and more researchers themselves who have disabilities.
Exactly.
And,
as I experienced hearing loss and in my 40s began to have trouble listening, picking up messages on my answering machine and using the telephone, communicating in restaurants, I was like a lot of people. I denied that I had a problem, but one time I was working late in my office here in this building, and I was on a conference call with somebody, or a call with somebody from one of your time zones, maybe talking to you in Texas, I don't know. But it was at the end of the day at 5:30. My phone call ended. Most of my colleagues had left. My door had been closed because the phone call needed privacy and quiet. A fire broke out in the building, and the alarm in the building went off, but the bell that was right outside my office didn't work. So the only bell that was ringing was way down the corridor. My door was closed. I didn't hear it. Fortunately, someone came by and found me in my office, and I left the building.
But that was a wake-up call for you.
That was a wake-up call. When I went home and told my wife that there had been a fire and I hadn't heard the alarm, she said, "You don't hear me at dinner time, you don't hear the phone ringing, and now you don't hear a fire alarm at work, and when are you going to do something about it?" And so that led to my use of hearing aids for my moderate high-frequency loss. But my mother is now in her 90s, and she's essentially functionally deaf. So who knows what direction that I'm going in terms of disability. And my wife is a person who lives with chronic fatigue syndrome, and being with her and seeing the difficulties that she has had interacting with physicians, problems with the environment, you name it, has also sensitized me personally to many of the issues. But the stories that people tell and the opportunities that we get to see in our research programs is probably the most influential aspect of my own thinking.
Now, Dick, we've talked about people who work for the agency who have disabilities and are sensitized and presumably able to convey to the program and to the people who work in the program extramurally the importance of rehabilitation research and the need to have it focused on specifically on the needs of individuals with disabilities. But there are other roles people with disabilities can play in the community, and among those roles are those of peer reviewers, assisting with the long-range plan, working with individual researchers at sites around the country in their programs as advisors and consultants, and many other ways. Are these important things for people with disabilities to do?
Oh, definitely. NIDRR has been working to examine its processes and to where the big word in government these days is reinvention. Everything is being reinvented. We're looking at ways to improve procedures. Most of the time when they say that, they're talking about personnel systems. They're talking about ways of managing programs to maybe reduce costs and reduce the burden on citizens. In NIDRR, many of our efforts on reinvention have focused on ways that we can carry out our mission better with people with disabilities. And so we're looking at program review meetings that, in addition to for our larger centers and projects, and with experience with the research and training centers and the ADA, DIBTAC programs, you're aware of the many requirements that are presented, but opportunities too. People write a grant proposal, they send it into Washington, they want it to be reviewed not only by the scientific experts who know what a subject area should include and does include, but they also want it to be relevant. Our credo has been scientific excellence and consumer relevance, and both need to be reflected in our peer review process, in our ongoing peer review or monitoring while a project is in process, and in relation to the products that come out of the work.
Now, Dick, is it fair to say that if a research proposal is not relevant to the issues of people with disabilities, as well as the issues that it's obligated to frame otherwise, that it won't be funded?
That's a tough call. The definition of relevance and the way in which we operationalize the concept is a very tough call. We've had proposals that have been submitted to us that have had very high peer review scores, but when we look at having a limited number of awards that we actually can make, it becomes a very tough call as to what should actually be funded. And I think that's where having a long-range plan that helps to prioritize the most important items, where the wider disability community, plus those who serve as providers, those who serve as researchers, those who are in positions of administration, have an opportunity to state what they believe the gaps are and what they believe is feasible, because sometimes it boils down to not only should it be done, but can it be done? Mm-hmm. What's the risk? In a research agency, you do want to take some risk. You don't want to say, we don't want to try to build the better widget, or I could use a disability-related example, but as soon as I start to, someone's going to say, oh, you were talking about my project, or you were talking about my initiative. So I'll be very circumspect. I don't know who's going to watch this and say, you were talking about my project that didn't get funded. But the process of communicating with our publics is vital to carrying out the role that has been entrusted to NIDRR. We are very fortunate that we have a broad, almost sweeping mandate to address disability rehabilitation research. We deal with people of all ages. We deal with people of all disabilities. We deal with health and function issues. We deal with technology issues, both the technology that can improve how an individual functions. My hearing aids are an example of an individual accommodation. But if this room were equipped with an assistive listening system, it would be an example of an environmental modification that would be of great help to me. Mm-hmm. So technology, we look at how access to technology and access to the environment can be improved. We look at community integration, and we look at independent living and how those concepts can be operationalized and researched, and employment outcomes, because employment is such an important value in our society, and we look at capacity building and ways that capacity building can be enhanced. Well, when we're dealing with a project that in one way or another has to be rank ordered or prioritized, we have the challenge of determining not only its scientific excellence, but its ultimate relevance. And to get back to your initial question, is there a role here for people with disabilities? Certainly. They can help us to make those choices and to do that prioritizing, rank ordering.
Now, Dick, again from an historical perspective, can you think of 2 or 3 initiatives that NIDR and its predecessor agencies have taken through the years that you believe are fundamental in the development of independent living? And I can help you with some of those because...
I have a few that I would list, and the first one that I would mention would not probably come to mind of many independent living people. I think that NIDA's work over the years and its predecessor agencies over the years on emphasizing that function and access to environments are crucial to operationalizing concepts of disability have been extremely important. I think how you define and put a label on what disability is extremely important. And for centers of independent living and others concerned with the independent living movement to be successful, I think, to work to improve all of the different elements of a comprehensive lifestyle for people with disabilities, you need to be talking a language that that people can understand. And NIDRR, nationally and internationally, as you know, because you've represented the United States at various international meetings, we've taken a lead in getting people to go outside the box, go away from a label of a person as a person with spinal injury or a person who's deaf or whatever, and to instead look at what does this mean in terms of how the person can function. And that's what's the key factor. So I put that kind of near the top of my list. What else did you have on your list?
Well, early on, I know this research agency funded some of the early independent living demonstrations. One that we were involved in Houston called New Options. We had some research demonstration money, and we actually brought people from nursing homes into the milieu of
I remember that. I remember the very early days of New Options. I remember the very early days of the Boston Center for Independent Living.
Exactly.
I remember the very early days of the Berkeley Center for Independent Living. And I think at one point that perhaps Boston, Houston, and Berkeley were the triangle that was the starting point and the foundation on which the independent living movement was built. I remember one time in Boston where I went to visit the very first physical location of the Boston Center for Independent Living. It was in the old theology building of the Boston University. There had been dorms for that.
Right.
And I went in on a Saturday and walked into the room to see what it was going to look like, where it was going to be. And I heard these big thumping noises and wrecking noises. And I walked into the room, and who was there but Paul Corcoran? Do you remember Paul?
Sure do.
Paul Corcoran, a physiatrist from a medical rehabilitation doctor from Tufts New England Service, was there with a big sledgehammer. He had become frustrated with when were they ever going to make the toilet stalls accessible.
Yeah.
And so he decided to come in with a sledgehammer and break the things down to get that job moving a little bit faster. But the interesting thing about the Berkeley Center for Independent Living, how they got their first grant, they came to meet with Ed Newman, the commissioner. I say they, folks like Larry Biscamp was one of the early persons working with Ed Roberts. They came from California, and they wanted to have startup money for what they were calling an independent living center. And of course, we federal bureaucrats, I was only about a year into working in Washington, but I still had, I was with the federal government, and we're looking, we're saying, where is this in the legislation? Well, it wasn't in the legislation. This was before 1972.
Right.
Where was it? We didn't have anything that was called independent living. What we ended up doing was we ended up telling them that we had planning money for facility grants, for workshops. And what happened was that we said, but it doesn't say in the legislation that when you do a planning study that you have to find that there is a need for another workshop. So we could give you a grant to do a study to see if there's a need for a workshop, And you would come back to us and say, there's not a need for a workshop, but there's a need for something called the Center for Independent Living. And I think we gave them a grant for $50,000. And lo and behold, they went out, and what did they find? They found there wasn't a need for a workshop, but there was a need for a Center for Independent Living.
And that imaginative kind of approach to research is really what stood this agency well through the years. Dick, as we conclude this interview, what would you say are the real needs for the future in terms of research and independent living?
Wow. Our long-range plan does provide a number of examples that included that process of consumer input and consumer involvement in helping to define the questions. I think one of the tension areas continues to be the extent to which independent living is going to be consumer-run, consumer-directed, and mom and pop type operations, really close to the people who are served, and an advocacy-oriented approach, as it has been clearly the early days.
Right.
And then the types of things that you've been doing through the Research and Training Center, where you've been receiving funding from NIDRR to look at how to build the management capacity of independent living centers. We can't be, what is the term for it, Luddites? We can't avoid technology. We can't avoid the internet. We can't avoid all the ways of exchanging information and keeping current on what Kennedy Jeffens is going to include, or what will be the new HICFA initiative, or how that applies to the way that people can actually function. So I think the tension that's there is, how can we keep the spirit and success of the early years of independent living, and yet do a better job of training people and giving them the tools so that, like other professions, they can be effective advocates and effective administrators. It sounds like we're turning the CIL people into bureaucrats, but I'm sure that the spirit and the dimension of creativity will stay even as folks become more skilled. And I know many of them already are skilled.
Very well spoken and well said. I think this is the future of independent living, and with NIDR's support and the support of the Rehabilitation Research Program, your support, I think we'll be moving in that direction. Dick Melia, thank you very much for being our guest here on Focus on Abilities, and thank you for the years of commitment that you've given to this agency, to rehabilitation research, and to improving the lives of people with disabilities.
Likewise.
Thank you, Dick. Thank you all for watching Focus on Abilities. I'm Lex Frieden, your host. We've had the pleasure of being on location in Washington, D.C. at the National Institute on Disability and Rehabilitation Research with Dick Melia, the Director of Research, and we hope you join us next time for more Focus on Abilities.